We gaan verder met de volgende presentatie. En dat is met iemand uit Engeland. George, are you there? Good afternoon,
yes,
George.
I am. Thank you.
Good to see you.
Good
you
afternoon.
was not able to come over to here because of the travel problems there. Not even for a president of the British Travel and Health Organization, you could not do that. You are GP from, but also the vaccination lead of the Royal College of General Practitioners for ages, I think, for at least 25 years. And so you know a lot about how vaccination for flu is done in the UK. And that's the title of your talk. You're going to give us your view on the UK situation, and perhaps we can learn some lessons from you. Just go ahead.
Lovely. Thank you very much, Ted. And thank you for inviting me to be with you today to discuss how the UK achieves high influenza vaccination rates. Now, the three foundations for a successful influenza vaccination campaign are the government, the primary care, because that's where the vaccinators are, and the patients. In the UK, we have a government that is very committed to preventing influenza through vaccination. And the whole country has one policy. The government works with its stakeholders and is guided by its experts, the JCVI, and really acts on their recommendations. The influenza vaccine is entirely free for all the groups that we vaccinate on the NHS. And the government supports public health tremendously. And they provide us with everything we need, electronic or paper, leaflets, posters, and even slides for lectures. Everything is there for healthcare professionals to use to educate patients. The government defines very clearly for us the groups at risk. And very important is that the whole country, the whole UK, has one national GP IT system. So on every GP's desk, there is a computer that doesn't belong to the GP, belongs to the government, and everything is coded, it goes onto one IT system from which the government can extract the information any minute of the day to give us regular weekly updates on the vaccination rate and circulating viruses and a lot more information than that. It incentivizes us, the vaccinators, and is always in front of us. It encourages to achieve higher and higher and higher vaccination rates. The JCVI, the Joint Committee on Vaccinations and Immunisations, is a committee of experts to which the UK Health Security Agency, used to be called Public Health England, feeds with clinical trials, vaccine coverage. They do the monitoring of safety and efficacy. They do surveillance, serological and disease, mathematical modeling. All that is fed to the JCVI. And the JCVI takes decisions and either recommends or advises the government. If the JCVI recommends to the government something, for example, vaccinate healthy children, as they did in 2012, the Minister of Health has no alternative. The government cannot say, no, I cannot do that, or it's too expensive, it's £100 million, I cannot afford it. They have to do it because the experts said so. But when the experts advise, then the government may or may not take their advice. The government regularly updates the Green Book, which is the Bible for us on vaccinations. It publishes very early the flu plan, the e-letter, but also it gives us every week a weekly national influenza and now COVID surveillance report where you can find in 91 pages, this is the last one you see there, there are graphs and everything is updated every week. And every week we actually get to know what is happening in the UK. And you can see here one of the graphs where you see that the 2020-21 influenza is a flat line on the very bottom. Now, we at the Royal College of General Practitioners, we have the Research and Surveillance Centre, which is based in Oxford at the university there. And we have about 2,000 practices around England that the GPs code and record everything they see. And also they send respiratory swabs to Collingdale for analysis. So every Thursday we extract that information, and the week after we put out the information, which you find that Public Health England uses a lot for their reports. What you can see here is last week, and you can see the lines for all ages are starting to go up for influenza-like illness. It's a warning to us that flu is here and is coming. The Department of Health provides us with posters, leaflets, everything you can imagine in every situation, electronic or paper, entirely free, as long as we educate our patients and our healthcare professionals to get them to come forward to have their vaccinations. Now, these are the groups that this year we are vaccinating entirely free on the NHS: healthy children aged 2 to 15, anybody 6 months to any age with a chronic disease. And last year, we were vaccinating 65 and over. This year, regularly from 50 to any age upwards, they're going to be vaccinated. Pregnant women, people in long-stay residential homes, frontline healthcare and social care workers, entirely free, carers of our older patients and disabled patients, household contacts of immunocompromised patients. Also, we have specific vaccines for specific ages in order to avoid a reduction in effectiveness for AH3 and 2, which, as you know, is antigenic drift, is immunosenescence, and is egg adaptation. And we try to avoid those by having specific vaccines for specific ages. 18 to 64, the recommended vaccines are the cell-based quadrivalent and the recombinant quadrivalent. While if these two, for any very good reason, are not available, then we're allowed to use an egg-derived vaccine. Otherwise, no egg-derived vaccine and no trivalent. For 65 and over, we use the adjuvanted quadrivalent. The high dose is recommended, but is not available in the UK. If for any very good reason the adjuvanted quadrivalent is not available, then we can use the cell-based and the recombinant vaccines. Children aged 2 to 18 will get the LAIV, but if it's contraindicated, immunosuppression, for example, or the parents refuse because they say, I don't want my child to have porcine gelatin in the vaccine, then we can give them the cell-based quadrivalent, which is really a license from the age of 2. If that was not to be available for a very good reason, then we're allowed to use the egg-derived for them. And of course, egg-derived is the only vaccine we can use from 6 months to less than 2 years. On the pharmacy fridge in the practice, we have got these posters so that nobody can go wrong as to which vaccine to give for which age. Primary care, we, that's GP, nurses, pharmacists, we are committed to influenza vaccination. We get vaccinated ourselves to be the example for our patients. We are well organized in our pharmacies and our primary care centers. We train our staff. We train our professionals. We provide information for our patients in the practice, on the website, in the local media. This morning, I was speaking on the need for influenza vaccination on BBC Radio for Berkshire. That's what we do. We offer convenient times and opportunities for vaccination. And of course, having got the national IT system, we're able within minutes to search again and see who has not been vaccinated and call and recall. In the last 2 Saturdays, my practice has been vaccinating, and we vaccinated on each Saturday 1,200 patients. During the vaccination session, we see on the computer who has not been vaccinated. Yes, it's 2,000, 3,000, 4,000 of them, but we actually text them and we say, we have reserved a vaccine for you. Please come and get it. And they come forward and they get vaccinated. We are incentivized. And also we have open access for our patients to vaccination by involving our colleague pharmacists. And of course, the school services vaccinate children at school. When I open the notes of my patient, what I see is their past medical history, but this yellow flag, which I can get rid of by right-clicking on my mouse, tells me that I haven't taken whatever is blood pressure or the cholesterol is not within the right level, but it tells me that this patient has not had their flu vaccine. Opportunistic vaccination very important. And of course, there is no stronger message you can give to your patients other than you being vaccinated and getting the patients to know about this. On my left, I have got this photograph in my consulting room, and the patient sees that. And when I have finished dealing with their problem that they came, many times I will not even mention influenza. They say, can I have my flu jab talk now? And I do that opportunistically. And here is our colleague pharmacist. We involved them in 2015 when they gave just under 600,000 vaccinations. Last season, they gave 2.76 million access for influenza vaccination to patients because they're open on weekends, they're open in the evening, early in the morning. We get about £10 for each dose, pharmacists something similar, but by contract, they have to inform the GP that day or by the next working day that the patient has been vaccinated by them. Why? Because then I put it on my computer and the government and I know that that patient has been vaccinated. The other thing we have been doing is the quality and outcomes framework, which we call QOF. And here, for these very high-risk patients, we give GPs additional money to vaccinate, and each point is about £195. And you can see for coronary heart disease, if I vaccinate 55% of my patients, I get no additional points. At 56%, you see on the right, I get 1 point. But if I vaccinate 96%, I get all points. And you see in a minute what my practice has actually achieved. And this now we have been doing for quite some time. GPs know how to do it. They are doing it. There is no point continuing. We have changed it now for the hexavalent, for the MMR, for the shingles vaccine, and so on. But we have not abandoned the influenza. For the 65 and over, 18 to 64 in the groups at risk, and children 2 to 3 years, because we vaccinate them, the school services take over from the age of 4 years. There are these points and this money allocated, but there are these thresholds we need to achieve. And here, the primary care center has to achieve this. That's to say, my practice is joined with another 2 practices as a primary care center. If we achieve in my practice, but they don't achieve, nobody gets anything. I have to make sure that all of us achieve those thresholds that you see there. What have we achieved as regards to vaccination rate last season? 80.9% of the 65 and over have been vaccinated. 6 months to 64 in the groups at risk, 53%. Pregnant women, we remain stagnant at 43.6%. Probably because the COVID vaccine was not really recommended to start with for pregnant women. It was, if you want to, you can have it. But now, of course, we definitely recommend it. And I'm sure this year we're going to do better. Our healthcare workers is, well, just for the NHS, not just social care, but just the NHS, over 1 million people are employed by the NHS. We offered the vaccine to all of them, 100%, 76.3% have achieved it. Now, this is my practice. We have 23,000 population in the practice registered with us. And you can see over 65s, 88% vaccinated. Under 65 in the groups at risk, 64%. Pregnant women, 68%. Women that are pregnant in the groups at risk, 79%. And staff and us, 97% accepted vaccination. What about those high-risk patients that I mentioned to you? Near 100%. We have 1,080 diabetics in the practice. 1,026 diabetics have been vaccinated. The rest, despite repeated calls and recalls, they chose not to get vaccinated. Children, GPs vaccinate 2 and 3-year-olds, 56.7% in the whole country. In my practice, 85% for the 2-year-olds and 82% for the 3-year-olds. But as you can see, the school services have done an excellent job vaccinating 60+% of the children at school. So patients, they're aware of the burden of influenza infection. They are well informed. They believe in vaccination. They know that they need to get the vaccine because they are in the clinical groups at risk or because of their age. They respond to our invitations. They get vaccinated. and they become ambassadors for flu vaccination among their friends, their family, the media, and so on. Also, parents that really allow their children to get vaccinated. Look at my practice, how they allow their children to be vaccinated. And we work very closely with patients' associations. So this is my last slide, which really points out that for a successful campaign, you need to have the government, primary care, and patients working in synchrony. If one of them is not engaging, then the vaccination campaign is not stable. Thank you.
George, thank you. You are making us jealous. As a matter of fact, we had this kind of vaccination rates at the beginning of this century, but it's a long time ago. And you show us how important it is that governments and patients and professional organizations work together and that use incentives wherever possible. Is there any question from the public? There is one from the public online. Thank you for your presentation, George. I think one important difference between the UK and Holland might be the factor that GPs, nurses and pharmacists committed to influenza vaccination, and there are not as much as in the UK. We looked at differences in vaccine coverage between committed staff and no so committed staff, and that could not explain the differences in vaccine coverage. Do you have any knowledge on the contribution of this commitment factor on the vaccination rates? Being committed.
Yes, generally, the healthcare professionals here in the UK are really very, very committed to vaccination. They go out of their way to vaccinate. And look at what we did with COVID vaccination. 75% of COVID vaccinations were actually delivered in primary care. And it's the same with influenza. 2 Saturdays in a row, 1,200 patients to vaccinate. It's really unprecedented, but we do it. Because COVID has shown us how to do mass vaccination. And not only that, but during that session, when we were vaccinating influenza, we were actually searching on the computer. And if the patient has not had their pneumococcal vaccine or their shingles vaccine, or they are young and they didn't have their HPV or MenACWY, we actually offered it to them at the same time, and we vaccinated them. So people are committed to vaccination, and you can see the vaccination rates. That's the result.
And as you told us, giving feedback to general practitioners about the vaccination rate they got this year, so almost in real time, really also helps.
Indeed, because we get the vaccination rates in our area, and you see your practice being very high. Another practice is very low. That low is trying to go high, and I'm trying to stay up there. So everybody's competing with each other, and the end result, more patients are vaccinated.
George, thank you very much for your very interesting talk. We are going to think about it, and perhaps we can choose some of the most success factors from the UK. We'll go on now in Dutch. I'm so sorry for you that you cannot follow it, but you have other business to do also. Thank you very much, George.
Thank you, Ted. Thank you, everybody. Bye-bye.
Bye.